telecardiology in the state, similar to what UAMS does through the IDHI program to close the gap in stroke care. I think IDHI formed really a role model for the state with their hub and spoke model in delivering stroke care across and bringing the premier heart hospital. I would like your thought back to what Dr. Fletcher mentioned about the telecardiology and providing those services in Forest City or Dumas or any other rural Arkansas communities.
Again, a difficult question. I will say this. Certainly, I respect that technology a lot, but frankly, getting it to a lot of people is difficult, if not impossible. And we have explored it, and we've had to have clinics, and frankly, there seems to never be a substitute for having a doctor in the room. And having a doctor in the room to actually make the assessment, I personally right now favor that model, although it appears that through robotics we may be talking to an AI avatar at some point, and maybe not too long from now. But to get out there, you need to go out there. And that's one of the reasons we have about 20 cardiology clinics that are in small towns, generally less than 5,000 people. And what's happened over the years is that the rural part of Arkansas has, for the most part, the young people have migrated to the cities, either to the central part of the Arkansas or northwest or northeast parts of Arkansas. And they've left the people that have the most likelihood of having the disease in a rural setting with all the other reasons that we've mentioned that it's difficult either through education or transportation or whatever to get to the doctor. So having cardiology specialty clinics in rural locations, I have no doubt has had an impact.
Yeah, thank you. That is a difficult question considering a lot of Arkansans, particularly younger folks, move, the migration happens, and left with these smaller communities with significantly older adults and complex medical problems. Back to Dr. Bonds, again, being the regional programs coming under the umbrella of UAMS, how does UAMS embrace technology or AI in reaching some of the rural gaps?
Yeah, obviously we are very committed to technology, and we've had the stroke program you mentioned, and that has been a huge success, but it is a challenge. So we have 63 hospitals for whom we provide acute care stroke consultation by our stroke team if someone comes to the emergency room at that hospital. What I didn't realize until I got in this role a few months ago is that we are paying a lot of people to simply keep our docs credentialed at all the hospitals around the state because we can't give orders at those hospitals unless we have full credentials. So for anything that you try to do like that currently, if we try to do the same thing for cardiology, that's many folks who need to be credentialed at the hospital. So hopefully we'll look at what can be done at the state level for some centralized credentialing and things like that so that we can do more without the expense that goes along with doing so. But we'll continue to advance where we can. We're all trying to figure out AI and how we're going to use it in patient care. The Arkansas law requires that AI doesn't practice on its own. The last touch has to be by a human, and so that's our safety valve. And we're looking at how we use it. There are some areas where it's easier to use than others, and we'll continue to work with it and work with our students. You know, our youngest students are the ones who know the most about it. So.
Yeah. Well, thank you. So switching here to the silent killer, heart disease manifests differently in women compared to men. To American Heart, to Nikki Smith, what are some of the initiatives American Heart has engaged in increasing awareness about heart disease, because women tend to be the caregiver and they take care of the family more than they take care of themselves. So if you could address, please.
Thank you for that question. So I have a little bit different answer for you, so I'm going to wrap my head around the question. So we are doing programs around the state and the entire state that we call blood pressure management programs. So that's going to be one of the key things that we're doing. So that blood pressure management program, you can go to a county library, there's community organizations where in fact, we have one, I think, at a WIC, where pregnant women are being seen there when they're getting their benefits there. But the blood pressure management program it sounds really simple, but there's so many people that are walking around in Arkansas that do not know they have high blood pressure, so they get their blood pressure checked, and when they discover that they have high blood pressure, the blood pressure monitor that Dr. Fletcher talked about, those little cuffs that you take home, we send them home with that on a loaner program, and then we encourage them to go to their healthcare provider, and if they don't have a local healthcare provider, we provide them a list of resources, especially if they're uninsured or underinsured, on where those resources are available so that they can then be managed through the clinician and determine if it's medical intervention or lifestyle interventions. That's one of the things that we're doing. I mean, I really truly believe that it's going to take a whole village to help reduce the high blood pressure rate on there. But then education is another really big part of what we do. You know, for women to hear that number one killer of women is heart disease, and that you need to know your numbers, including blood pressure, that's one of them.
Thank you. Thank you. I have so many other questions, but in view of time, you will never see a podium where so many architects of health for Arkansas are sitting. So I'm going to open up to the audience to see if anyone has questions for these architects. The microphone is coming.
We're starting to see more and more nurse practitioners as opposed to seeing actual doctors in our health visits. How much of an impact is that in the cardiovascular area happening? Is that going to continue to be a precedent?
Doctor.
Well, we have an equal proportion. We have just as many nurse practitioners as we do physicians, interventional cardiologists. It's virtually a one-to-one. And fortunately for me, and cardiology is not that hard, all right? It may seem like it's hard, but we've only limited to about 22 or 24 diagnosed in the differential diagnosis. And so having a very competent and skilled and hugely experienced nurse practitioner is a real asset, and certainly affords the ability of having the cardiologist see a higher volume and higher acuity of patients, or aiming the cardiologist at the higher acuity patient rather than what might be interpreted as just like a well baby check of somebody that's stable.
Any other questions?
I can tell you that UAMS is very bullish on the use of APPs, whether it be nurse practitioners or PAs. We simply just don't have enough doctors for our state, and this is a way we can take care of more patients. And this is how we can improve the health of Arkansas, by having people they can see. I tell folks, people think about med school being so difficult to get in. You know what our most difficult program to get in now is? PA school. 600 and something applicants for 40 positions. The rate difficult than the med school ratio. So when parents call me upset because their child didn't get in PA school, I ask them if they thought about applying to med school.
Thank you, Dr. Bonds. One last question.
Okay, thank you all for what I heard today. Is there anything out there to address what I call the deer in the headlights effect? When people find out that their blood pressure or cholesterol is out of control, they tend to go and hide, and they don't want to know, they don't want to seek out attention because they have a fear of losing some type of lifestyle
Anyone wants to take the tough question?
Okay, I'll bite. Yeah, that's a hard one. That's a tough question. One of the things that we are seeing is the use of the whole entire medical team to wrap around that patient. It is scary, especially if you've had a family member that had a horrible outcome, so you don't want that to happen again, right? Trust is also an issue in a lot of our areas, and so we have to use as much of the healthcare team as we can to wrap around those patients. And so that means that, of course, the physician may give them the initial news, right? And then there's a nurse that may come and talk to them, but it's employing everybody to make it something that's manageable. So the pharmacist, for what your medications are, how do you take them, what do you do, what is this going to treat, why do you need to take this? The dietitian to talk about your food and your nutrition part of it. Community health workers who can help them do things like make sure you're taking your blood pressure. Do you have a blood pressure cuff at home? Do you know how to use it? So figuring out how to wrap around the entire medical team around them, because the serious answer is that patients are oftentimes afraid of their physician. They won't say it, but they're afraid of what you're going to tell me when I come in to see you. So I'd rather go hide and not hear that information. But we as medical providers have to wrap around them and pull them back in so that they get the information that allows them to continue to live and to thrive, and have a trusted person that's there that they can talk to that may not necessarily give them medical advice, because community health workers can't do that, but they can connect them with the resources of where they need to go to get what they need to get.
Well, thank you. I think we're about time now. Let's give a round of applause for our panelists.
Let's give this powerhouse panel one more round of applause. They were so great. So great. Did you know that the health of your teeth and gums may have a direct impact on your heart health? It's my pleasure to introduce Dr. Takaya Jefferson for her presentation of Beyond the Smile, Why Dental Care Matters for Your Heart. She's an expert in the field, and Dr. Jefferson will shed light on the vital connection between oral health and cardiovascular wellness, explaining why the path to a healthy heart often begins in the dentist's chair. Please help me welcome Dr. Jefferson.
All right. Hello, everyone. So thank you for being here today, and also a big thank you to Kenya Eddings for this opportunity, as well as pushing me beyond my comfort level. So again, my name is Dr. Takaya Jefferson, and I am very excited to share this very important topic today. The presentation is called Beyond the Smile, Why Dental Care Matters for Your Heart. So most people think of dental care as just the teeth and your smile, right? We hear a lot about veneers or teeth whitening. But what we'll talk about today, explore more on how what happens in your mouth sometimes just does not stay in your mouth, and how oral health is deeply connected to heart health and your overall well-being, especially in underserved and minority communities. So before we dive in, I do want to share a quick story just from my practice. So I treated a patient with advanced gum disease as well as uncontrolled high blood pressure, which is typical, my patient count typical, which is typical of my patients that I see on the daily. However, what stood out was that my patient had a complete surprise when we discussed how their oral health could possibly be linked to their heart condition. In that moment, my patient stated, "No one ever told me that my mouth could affect my heart." And this is exactly why conversations like the ones today that we're having are so important. So, I want to kind of make this a little interactive. I'll ask a couple of questions as I continue through the slides. So raise your hand if you've ever viewed dental care as a complete separate entity from medical care. Okay, we have a couple in the back, yeah. It is pretty common, and so that's exactly why the gap we're here to address today. So let's start why this topic matters. Too often, oral health is treated as separate from the rest of the body. Dental care is placed in its own category. If you think about it, we have our own dental insurances, different systems, as well as different conversations. But in reality, it's all a part of the body. Our mouths are actually the gateway to our body. So when oral health is neglected, it contributes to a series of health conditions, including heart disease. This is especially critical in minority and undeserved communities, which face higher rates of both oral disease as well as cardiovascular disease. So this isn't just about teeth. This is about health equity, prevention, as well as saving lives. So let's begin with the basics. Understanding the tooth and gum structure. As you can see on the screen, I have a pic diagram here of an actual tooth. The outer part of the tooth is the enamel. That's the hardest substance in the body. It protects the tooth like an armor. Beneath that lies the dentin. Then you have the pulp, which contains the nerve as well as the blood vessels. So if you've ever had a toothache in here, it's typically a sign that now infection has gotten into the nerve, and it's leading sensations to the body to let you know that there is a problem happening. The gums form a tight seal around the tooth, and the periodontal ligament and the alveolar bone anchors the tooth into place. So it's basically our foundation. Understanding this structure helps us to see exactly how infection begins, as well as why early problems can spread deeper. Now that we know the tooth structure, let's see what happens when things can go wrong. What is gum disease? Gum disease is also known as periodontal disease. It is a chronic infection caused by plaque, which is a film of bacteria that forms daily around our teeth. Gum disease often starts as gingivitis. This is the early stage. So during this stage, you typically can see that your gums may appear red, swollen, as well as bleed easily. If this is left untreated, it can progress into periodontitis, which is a more severe stage, and this damages the bone as well as the tissue supporting the teeth and can eventually lead to tooth mobility and cause tooth loss. Most importantly, periodontitis is the most severe stage and is a systemic inflammatory condition that is highly linked to heart disease. So here we see common signs to watch out for. One of the biggest challenges is that gum disease can be painless in its early stages. Many people don't realize the problem until it actually becomes more advanced. So by a show of hands, how many of you have experienced or know someone that has experienced any of these symptoms that may be on the screen here? Yeah. So awareness is the first step towards prevention. Now let's connect this to the rest of our body. Our mouths contain bacteria all of the time. But when gum disease is present, harmful bacteria can enter the bloodstream through inflamed gum tissues. This is what triggers chronic inflammation throughout the rest of the body, which contributes to plaque buildup, possibly in the arteries, increasing your risk for heart attacks and stroke. This connection remains underappreciated despite years of research. So how many of you actually knew before today that gum disease could affect your heart? So let's look at the disparities. Unfortunately, not everyone is equally affected. Minority communities and rural populations carry a much heavier burden of both oral health as well as heart disease. And according to research, untreated tooth decay remains notably higher in non-Hispanic Black adults. This difference is not very random. They're all driven by systemic issues, things such as limited to access care, affordability, insurance coverages, and historical inequities. It's very sad, but it's also true that many communities just simply do not have access to preventative dental services. And when care is delayed, it also leads to conditions becoming more severe, which then leads to them becoming more costly to even treat. So raise your hand if you've seen patients or community members struggle to access dental care. I think we can all attest to that. When we look at income levels, the pattern is still very clear. Low-income individuals experience periodontitis as nearly twice the rate of higher-income groups. These disparities don't just affect the oral health, they also affect overall health outcomes. Now talking about heart disease in the US, as Dr. Fletcher already told us, cardiovascular disease remains the leading cause of death in the United States. And high blood pressure is known as the silent killer, even if our patients think that a high blood pressure is their normal. This is normally, minority populations are disproportionately affected. Because oral disease and heart diseases share many risk factors, which include smoking, diabetes, poor nutrition, as well as the same inflammatory pathways, addressing one can also support another. So this is what creates a powerful opportunity for broader prevention. Okay, I'm gonna ask another question. I want you guys all to be honest. How many of you floss every single day? Okay, we have a few out there. Okay, so the good news is that both gum disease and heart disease are largely preventable. Simply daily habits can make a huge difference, speaking on the oral health side. Brushing twice a day with fluoridated toothpaste, flossing daily. I always encourage my patients to at least floss every single night. Eating a balanced, heart-healthy diet by limiting sugary foods as well as sugary drinks, avoiding tobacco products, and visiting dentists regularly for your checkups as well as for cleanings. These are just small actions that can reduce inflammation and lower your long-term risk. And by the way, there's no judgment for those of you that did not answer for flossing daily. So raise your hand if you've worked with community organizations or outreach programs, which I assume that a lot of us have. To truly make a difference and to create lasting change, we must go beyond individual habits and focus on community solutions. We need to meet people where they are, in trusted spaces, for example, churches, schools, community centers, and local organizations. Community health workers can play a critical role in education as well as outreach. And culturally competent care builds trust, which is essential for improving health outcomes. This kind of collaboration is exactly what we need more of. So what can we do? For healthcare providers, this means integrating oral health care into routine care. For public health leaders, it means simply advocating for better policies. And for all of us, it means working together across disciplines, including medicine, dentistry, and community organizations. We cannot achieve health equity while treating the mouth as separate from the body. So I want to close by returning back to the patient story from the very first slide. But imagine a different future, one where patients learn early that bleeding gums aren't normal, and that caring for their mouth also can protect their heart. They start to adopt simple habits like brushing and flossing regularly, seeking preventative care, and make consistent small changes. And eventually, over time, those actions reduce inflammation and lower their risk for serious diseases that may come. That's the opportunity that we have now, not just to treat disease, but to educate, to prevent, and to empower communities with knowledge that can literally save lives one smile at a time. And that is my small TED Talk, guys.
give Dr. Jefferson another round of applause. You know, it is a privilege to introduce our next speaker, none other than Dr. William Greenfield. He's a professor of obstetrics and gynecology at UAMS and a leading voice in maternal health as the chair of the Arkansas Maternal Mortality Review Committee. Today, he's going to talk about healthy moms, healthy hearts, navigating cardiovascular risk in motherhood, where he will explore the critical intersection of pregnancy and heart health. Drawing on his extensive experience in reducing maternal health outcomes and disparities, Dr. Greenfield will provide essential insights into how we can better protect the cardiovascular well-being of mothers across our state. Please help me to welcome Dr. William Greenfield.
Okay, good evening, everyone, and thank you, Director Eddings and Commissioners, for the invitation to speak to you. I'm adjusting to wearing glasses for the first time in 57 years, so if I sometimes look like I'm straining, the struggle is real, okay? Okay. So over the next 20 minutes or so, I want to talk to you about healthy moms and healthy hearts as we close out this week of Black Maternal Health Week, which is a perfect timing. And I know I may be standing before you before the